is the same, whether it's shopping or heroin. If you're turning to that thing, either a behavior or an object, to resolve something that's feeling unwell, a distress inside of you, which could be severe depression, unhappy with what's going on in life, to try and cope with that, I call that an addictive process. That could be even a small vice like retail therapy, a sugar addiction, but it could also be a terrible drinking issue. Both addiction and burnout, it's sort of an undeniable symptom that's emerged.
Welcome to the Burnout Detox Kit Podcast. I'm your host, Sophie Theen. I'm an award-winning people and culture executive, keynote speaker, coach, and the founder of the Burnout Detox Project. For more than a decade, I help companies build high-performing teams and cultures across fast-growing businesses. But behind the scenes, I was burning out over and over again. So I saw the side of success nobody talks about openly. So each week, I bring you raw conversations, expert insights that will help you navigate your toxic workplace and finally understand what success should never demand from you. So if you press play today, it means some part of you is ready for that to change. Welcome, and let's get into today's episode. Welcome back to the podcast. I'm Sophie, and today I'm joined by Dr. Daniel Hochman. He's a psychiatrist who specializes in mental health and addiction. Daniel treats people grappling with burnout, addiction, and other health issues. And in his career, he stayed ahead of burnout by intentionally shaping his work. So together, we're going to unpack how burnout and addictive behaviors intersect and why people pleasers and overachievers are especially vulnerable. So welcome, Daniel. Great to have you here on the show.
Thanks a lot for having me, Sophie.
Well, first and foremost, many of us have turned to our vices, whether alcohol, substances, or compulsive behaviors, just to name a few, when work stress becomes really overwhelming. In your experience, how often do addictive behaviors or burnout coexist? And what type of relationship does this look like?
Yeah, one of the reasons they run together so much is because both of them have a lot to do with not paying attention to what's going on inside of you. So in both cases, they could be viewed as surface level symptoms or behaviors that happen when underneath that, there's something that feels like we're in conflict, unhappy, stifled, frustrated, things like that. So it's not uncommon at all that someone who's getting burnt out is also having a struggle with what to do about that. And so they also turn to other vices and things for that release valve.
And do we only call them vices if they are intentionally, say, harmful to us and it creates a negative impact? What about other types of, say, addiction to, I know we'll talk about overworking a little bit later, but what about like, say, they're overwhelmed, they're really stressed, and maybe they overwork themselves at the gym, or, they change their habits, they change their diet, or even, compulsively shopping as well. Does that consider too, for as long as it looks like they have something to use as a coping mechanism?
Yeah, your question gets to the core of why there can be so much confusion around addiction. Even among the clinical world, do we call a shopping addiction like a clinical disorder? Is that an addiction? So to me, the confusion is because the process underneath it is the same, whether it's shopping or heroin. If you're turning to that thing, so it's either a behavior or an object, to resolve something that's feeling unwell inside of you. So whatever it is that you're uncomfortable with, if you're turning to things outside of you to try and cope with that, I call that an addictive process. And so that could be even a small vice like retail therapy, right? Could be a sugar addiction, but it could also be a terrible drinking issue. So the process is the same. Where people get confused is, yes, if you have money and you control your shopping addiction to a reasonable degree, no one's really going to call you an addict. There's not going to really be a treatment center for you. You're not going to get as much sympathy, and nor should people be all that concerned as opposed to, turning to heroin. So the safety issues or the severity to health or life should be separated in my mind from doing work on ourselves to resolve what's going on underneath it.
Fair enough. And what should listeners understand about why we reach for these crutches? And if in your experience, you've seen healthier ways to cope when life feels, quite unmanageable?
Yeah, there's a lot of ways to think about that because if you're listening to what we're talking about, you realize, well, everybody does turn to something to get through the day, let alone the week or life. So say you turn to sweets sometimes. I happen to think that that should be a part of a regular healthy life to have some vices. To me, the key is to be aware of what we're doing, how much, and use those more as signals than try and just clamp down and restrict ourselves from anything that lets us take a break, let loose, or just not take life seriously for a moment. So for me, it's not just making the right choices every minute of the day, but if I'm gonna have like a good amount of chocolate later today, I want to know what's happening for me. Is it because it's a bad day? Is it because I got bored? Like, I just want to know what's happening inside of me. And if I understand that, I think of it like informed consent, right? If I understand what I'm doing and why, I now at least have the choice. Do I want to work on that thing? Or do I say, no, you know what? I'm okay with this. So as long as we have a gauge of what we're doing with ourselves and we understand where it's coming from, we can make a lot more informed decisions about ourselves.
I think you're absolutely right. Part of the reason why we go through burnout, and most people go through burnout in cycles, I'm sure that you've seen, is that they're not probably making enough informed choices for themselves. It's the same situation where I've spoken to multiple people where they seem to think that moving from one workplace to another should end the very burnout, but before they actually look inward and do some of that reflection and that hard work on themselves, until then, they wouldn't really actually understand why they were going through these burnout, even if they're going through different types of workplace environments.
Exactly.
Yeah. And I remember when we were chatting, you warned us against offering a one size fits all cure for burnout. And I think that's really, really important to note. Now, there's these people pleasing behaviors, blind overachievement, and I think you mentioned that there's also so much conversation around the rigid attachment to our identity. Right? There's the risk aversion and this sense of not having any options at all when we were in the thick of it. So people people lead themselves to the breaking point, the way I see it.
Mm.
Certainly, when I reflected on my own experience, now that it's 10 months past my major burnout, I would say, clearly I had choices. I had choices to quit the job 3 months earlier before my burnout happened. I had a choice to speak up for myself or set those boundaries and actually commit to those boundaries. So I did realize that I have choices. So can we talk a little bit about our choices and why we're not making the right choices for ourselves?
Yeah. You mentioned a few of the common reasons. So I don't like to just blame burnout on the rest of the world. It's very true that employers will just put way too much on people. But if you look around, you see that that happens to people who almost set themselves up for it. Right, the manager might realize that this person doesn't say no. So systems tend to emerge and our personalities have a lot to do with how that system unfolds. And so it's really important to understand who you are, because if you are, say, overly attached to an identity of a really, really hard worker, or you have this, rigid idea of always doing it perfectly, or if not perfectly. So these can be part of your identity. It can also part of why identity matters is not just with ourselves, but it comes down to what we want to be seen as in the world. And so, if we're not willing to let friends or family know that we left a job just because it got hard or it wasn't working out for us, and that would be seen as a failure, and that would challenge the ideas and notions we have of ourselves, you're setting yourself up for burnout, because it means there's an inflexibility there. So it's the rigidity to which we attach that usually leads to issues of burnout and addiction. If we're adaptive with it, then that means we could say, for example, okay, and this is true for most doctors. We're pretty self-selected, so we're often very overly disciplined, and we attach to this identity of like a real, I'm going to do good in the world, and so it's this helping profession. often also tied to just doing really well on tests. So we want to maintain, that being viewed as very smart. So doctors have this terribly stubborn self-selection, right, of wanting to be seen as all those things. If we were rigidly attached to that, then you're stuck just getting taken advantage of by hospital systems. And so when we attach to those things rigidly, it can be our demise. Whereas if we're flexible and say, hey, I'm trying to do good in the world, but I want to see my kids in the evening, or I'm being taken advantage of when I'm making less than the nurses around me per hour worked. Now other things need to enter that picture. It doesn't mean you're abandoning the idea of helping the world or being fair, but yeah, at some point we have to see where our stubbornness gets in our own way.
Fair enough. I guess that's also the kind of situation where you are left with compounded resentment, which is also one of the reasons why people lead themselves to burnout. So I really appreciate you saying that, you would caution against just blaming the job or the workplace. And you're absolutely right. You also said that burnout is often a voluntary transaction. So can we talk about that a little bit in terms of how does someone who is already so entangled with this identity, workplace, whatever it is that basically shapes their day to day, how do they then differentiate between the external factors that keeps them there versus the internal drivers that keeps them stuck?
Yeah, I would view it instead not really as like outer world versus inner world, but more a system. The system will always find its way, just like in a free market, right? So we call it price discovery in a free transaction market. There's a supply and demand. So the same thing happens in this way. If you're willing to attach to your identity and you will do more work for less, it will be discovered, of course, in the workplace. And where it's going to tend to go on for longer and worse is when you run into people that are not going to stop to care about what you're going through. And so where that typically happens is at work, because work wants more and more from you for less, right? There's less appreciation, less bonus, less reimbursement, less autonomy, less sort of recognition or praise or respect or boundaries. Ideally, the closer people are in our circle, we do have people who do that, and not everyone does. So think of it like a system issue. It's not necessarily such a terrible thing to be an altruistic person or really hardworking or have such a high ideal for your work output, that you don't really want to sign off on something that's kind of a crap product or service. Those things are okay, but you need to find a system where that's actually wanted or praised or recognized or needed. So when you find a good system for who you are, it can work way better. But you have to then be willing to make the compromises that takes. So that's what I find a lot of people when I talk about, this rigidity. And so it's up to us, not the rest of the world, to recognize the system we're in. And so if I want to do really, really high quality work, but not get taken advantage of, it's my job to go find somewhere where that's either the explicit or just implicit contract, so to speak.
Mm, And what about people? And what about people, say, for example, clearly, when anyone listening to this, I know the first thing they think about most of the time is, well, I don't have the privilege to quit a job or like to change or to pivot my career into what suits me. Or, sometimes even people get really ill from taking on burnout at work and then they have to take extended sick leave, which in some jurisdictions, they don't get paid for it, right? So for responsibilities that keeps us in these jobs and they keep us rooted, anybody who feels trapped today, are there any strategies that you would recommend for them to not necessarily begin healing, but begin the work so that they can actually go into the phase of, like you said, setting the right expectations for yourself?
Yeah, so we have trade-offs, right? So some people might be very ready, willing, or able to have a trade-off where they just don't take it in the workplace anymore. And so that they might have a spouse who's high earning. They may just be, well enough that, you can downsize or do other things. Some people are also more equipped to be creative. Like maybe we move out to a smaller town or something where cost of living changes. Some people have those privileges and it's easier for them to make those choices. Now let's just take a case where let's pretend they have none of those choices. I think it's important to then, so you can either, on this trade-off spectrum, you can either say, I'm going to make the choices I need to because I'm unwilling to satisfy what's being asked of me. The other one is to say, okay, people are asking this of me. They want more. And I know myself and I'm going to keep offering that, even though I don't really have the time, energy, or will to do that. That requires, it is harder work because if I'm unable to change anything about my scenario and I have no privileges there, now we're not in a free market, right? So going back to what I was trying to lay out in this framework, that's not a free market. So technically it's still a voluntary transaction, but boy, is it, my arm is really twisted here. That's now a very lopsided transaction. And so what you're describing in these hard situations is that, right? Where for one reason or another, I can't really leave this position. And so if that's the case, it does require the harder work is now making compromises internally. Okay. So if I'm going to stay in this job and they're asking this of me, am I able to produce an 8 out of 10 product? Can I allow myself to do that? But I will encourage people listening, although that's harder work than just changing the external circumstances, we're not actually compromising our character. We're just changing the system. But if we are being asked to do a lot and we don't have that privilege and we have to stay in that system, meaning we have to then compromise our rigid ideas of ourselves, that's harder work, but it is much more meaningful to challenge because we will grow much more when you look inward and can adapt as a person. And so that there's a meta game that we all play in life.
Fair enough. That's very well said in terms of still calling it, regardless the situation you're in, you're either working with your external circumstances, which, as you said, seems to be the easier way out, or if you are strapped and have no other choices, then working internally is also just as important, as you said, because it creates the growth. You're absolutely right. And for someone, say, they've been in autopilot, and we see this a lot when it comes to burnout. This person, or they continue to live the life that is clearly not good for them. People around them, families, friends, colleagues, see that they've turned into a completely different person, and they know it's not good for them. But this autopilot cycle is something they can't get out of. What about for people like that? Not quite even realizing that they are stuck and something needs to change.
Yeah. I mean, the nice thing about both addiction and burnout is that it's sort of an undeniable symptom that's emerged. So it might be easy for someone to say, no, I'm not really burnt out. If it's mild enough, you might be able to make that claim and sort of trick yourself into staying into it. But that's where, as much as we don't want people to hit brick walls with work or with an addiction, they're actually very useful because that is to be seen as the beginning of a new journey for that person. So it's the end of a chapter because it's like, this just doesn't work. I hit a wall where I got I'm drinking way too much. And so that's the wall, but there's a whole another life on the other side. So for those people, what we need to help them see is that there is a whole nother chapter, a much brighter, lighter existence on the other side of that. Because if you run into that wall, right, and it hurts and it feels terrible because you're being challenged and it's so difficult because what's going on inside of ourselves is something like, who I am up to this moment is no longer possible. Like I can't keep doing this thing anymore. It's not working. So the person does always recognize it when it's hard enough. They may not verbalize it or have a, sort of moment where they're being really vulnerable, but people realize it. And so the job of a friend or just to challenge yourself is, do I have the courage to see what's on the other side of that wall? Because it's a whole nother lighter, fuller, more meaningful life. But when you run into that wall, it just looks like that's the end. And people actually get very suicidal as well. I mean, that those are the kinds of patients I can get, is they hit the wall and that's very suicidal territory, because it's like who I am doesn't work anymore. So I'm now broken. I don't know what to do. But yeah, there are no rules. That's why I keep saying the rigidity. Right? You can walk around the other side of that wall. It's all available and open. So I encourage people to have the courage to challenge themselves there.
Hmm. And even on a personal level, I remember, Daniel, you said that you are not someone that associates yourself with burnout the traditional way. You've mostly managed to stay ahead of it. So, were there any choices that you particularly made in your early career that listeners can learn from?
Yeah. So and just to clarify, it's not as if I, whatever words we want to use. I mean, I get, you could say, mini burnouts, right? I mean, there's periods where I work too much. So certainly in residency, we're working 100-hour weeks, definitely burnt out. And I still remember just wishing that I could have like the mechanic's job that was in the elevator with me. And that actually, not just like in fantasy, but it actually felt like a better idea at the time. So yeah, I mean, I've certainly been, burnt out or overextended here and there, but well, there's a lot to say about that. I mean, in residency, you don't really have a choice. So that's again one of these water in a desert scenarios. But yeah, the biggest thing I'd say is that I want to always pay attention to how I feel as a person. And so that's what I try to follow. And that's how I can sort of stay on top of things. I took a job when I was first out of residency, and it didn't feel all that comfortable. And it wasn't necessarily the work hours, but the nature of the work. It put me in conflict, and I didn't like it. So I knew what I was feeling and why, and I created a plan, and then I started to practice. And even then, you find yourself, still not setting it up exactly, how you should. And so there'd be things again that I got uncomfortable with, but yeah, just making the subtle changes continually to make sure that I keep this, what I want. And for example, what we're doing right now is part of that, right? I mean, I feel like in my private practice, I can get fairly disconnected. I miss the academic world, but there are parts of that that I really don't want to turn back to. And that's a whole nother discussion. But so for me, being able to do this with the public and share some very well-known ideas and strategies and themes around this, that this is rewarding, and this is, some time in my week that is not just seeing patients. And so it's staying ahead of, what if I just kept plugging away with patients? Probably I would feel slight burnout, right? But so it's just finding little tweaks usually to stay ahead is much easier than playing catch up, when you hit the wall.
Absolutely. And as we all know, burnout often creeps up on us even without us noticing. There are so many small changes that we can make even from today onwards. By the time we recognize it, often it's already too late. So, to finish off with today's podcast, what is your one piece of golden advice that you can share?
Well, let's just riff on what you just said there, because I like what you brought it to. I think it's easier to think of exactly what we need to do when we hit that wall and we know it and we're ready and all of that. But yeah, what happens is people don't heed those warning signs, and then they justify things. It's like, just hang on, it's going to change, or this is going somewhere. Or they tell themselves, well, other people have it worse. There's all these little strategies people use to keep justifying the burnout. So I encourage people to test out the idea that, well, what if this really is just bad? It doesn't mean you have to be all in on, okay, for sure, I'm burnt out. Same thing with addiction. You don't need to say, okay, I'm this like raging alcoholic, I'm an addict, fine, fine. No, it's just to say, okay, what if I am turning to alcohol like more than I should? So same thing with burnout. Just leave yourself the opening to start to examine that, because what I see people do is set themselves up because they keep justifying it. So try not to justify it to no end, and that will be the opening to doing more comfortable, proactive work.
Amazing. Well, you have heard it from Daniel in terms of his golden advice. Well, thank you so much for coming on to the show today and obviously sharing very important things that we needed to learn, mostly about ourselves and the fact that we do have choices and we can make those we can make the right choices if we wanted to not be in burnout. So thank you very much for your time. I really appreciate it.
Yeah. Thanks a lot, Sophie, for having me.
If this episode resonated with you today, make sure to follow and subscribe to the channel so you never miss a conversation as important as this. The Burnout Detox Kit is here to make sure ambitious people like you recover from the burnout without losing themselves in the process. So if you know someone navigating burnout right now, workplace toxicity, even simply trying to hold it all together, share this episode with them. You never know who might need to hear it. I thank you for your courage today and thank you for being here. I'll see you in the next episode.